Well, that's a really good question. So anything, weight is carried differently based on your muscle mass. So the more muscle mass you have, the more you're going to weigh. That doesn't mean that you're necessarily overweight. So anyone who has a BMI above 26 is considered overweight. We do a calculation that allows us, based on your height and your weight in pounds, and we calculate your BMI. But if you look overweight, you're probably a little bit overweight, if that's a simple measure. And any pound that you lose, you take 4 pounds of pressure off your knees. So that's definitely part of the equation, and that's why the rehabilitation physical therapy portion of our program is so effective, because it kind of addresses your mobility, walking, range of motion exercises, strength and endurance, so that when you leave our program, you can continue to be active and continue to have an active lifestyle to help kind of maintain your weight in a healthy range.
What is that substance, hyaluronate?
Hyaluronic acid is a naturally occurring compound in the body. It's in several tissues, in your eyes, everywhere. It's natural. And what it provides for the knee is like I heard her say it, it's like WD-40 for the knee. It's like oil for the knee.
Oh.
It's like so now, instead of the bones grinding, they're actually going to glide on each other.
Well, is that a recent discovery, or is it?
No.
Is it existed under another name? I'm not familiar with the term.
No. It was developed in Japan, this particular medicine, in the 80s, I believe, and introduced to the market here in the early 2000s.
So does that substance, I read or heard that it helps your own body produce more of the natural component.
Right.
If that is true, then why do you keep going back for more injections? Why would it not
just... Because it acts as it serves as a catalyst to kind of jumpstart that process.
Right.
And as we age in general, the processes don't work as well as they used to. And so you just kind of need another boost to kind of get the process started again. That being said, this injection may not work for you. We have to just see. Your disease might be too far advanced. Your body may not respond. Your body may not enjoy, the catalyst kind of thing, for instance. So you may not respond to the injection. But more often than not, our patients do get improvement. 86% of our patients who do the rehabilitation and the injections do have wonderful success. They have some form of improvement. So
I've heard that variant result with cortisone also. And so if you're weighing one over the other, what is the factor that leans you towards this other one?
Good. I mean, cortisone has its benefits as well. It helps relieve inflammation. It helps relieve pain. But it's something outside or foreign to the body. It's exogenous to the body. So this medicine is actually a naturally occurring compound in the body. So it's a very natural process. In fact, you can be exposed to this medicine a lot, and you really don't have many side effects if you don't create an allergic reaction. But cortisone, you can have it in certain amounts. Otherwise, it may cause some deterioration of cartilage itself when you have overexposure to it. What sets our clinics apart from other places where you may have had these cortisone injections or even these gel injections is how we administer the medication. This is all given under ultrasound guidance, which is an image guidance modality. And I don't know if she can go back to kind of what the machine looks like. I don't have any kids, but this baby is this is my little baby here. It's a really cool machine. I really think it's just wonderful. And what it does, it really allows myself as well as all our staff to inject the medicine right within the joint space. I handpick our nurse practitioners, our other, even our medical assistants, and even the other doctors who work in our facility. I'm the medical director, but I train them to use this modality. And what that does, it really limits your chance for missing the spot. It limits your pain during the injection, and it just guarantees accuracy of providing or administering this medicine right where it needs to go. So that if in the end this doesn't work for you, then we can't say it's practitioner dependent. Rather, it's because the medicine, just is not going to work. Not every blood pressure medicine someone takes isn't going to work for you. Not every cholesterol medicine you're going to take is going to work. But at least when we give it under image guidance, we can guarantee that the medicine's going where it needs to go. And evidence-based medicine actually shows that if you do not use an image modality, being ultrasound or some kind of x-ray, the doctor, the practitioner, is not in the space a third of the time. So even myself, who I do this all the time, this is my bread and butter, I wake up and I breathe, eat, sleep, sneeze, even myself will not be in the space a third of the time. And I'm going to show you why that is. If you look at, this is the knee here. This is the lateral or the outside of the knee. This is the inside of the knee. And this is, let's pretend, my needle, which is probably much smaller than this even. And if you just look at the tilt of the wrist, this is the joint space. The doctor or the practitioner may not be in the right spot. How many times can you guarantee that my wrist is going to be, a couple millimeters off? With the ultrasound, even if the medicine, even if initial injection goes in here, I can just easily slip down and put the medicine where it needs to go. And so this is really state-of-the-art, I would say, equipment that we use to, and that's what's new. The medication is not really new, but how we provide and give the injection is really the new technology that we're using here. Any questions? Any other questions for me?
I've heard that with the Synvisc, it's kind of outdated and it has formaldehyde or something in it, and this is supposed to be better. How, and I think she was